Namaskara. I am Dr. Anupama Santosh, Bengaluru's most trusted fertility doctor with over 500 natural conception success stories. In my Wednesday knowledge sharing series about male fertility, so far I have shared many insights starting from why it's important to do the semen analysis right at the beginning, and then I have shared the list of blood tests for the male partner, and then I have discussed how, when, where to do the semen analysis in detail. I've also explained how to understand your own semen analysis report, and many of you have appreciated the advice about the food list I shared, and also the lifestyle changes along with the exercise routine to improve your sperm health. Last Wednesday, I also shared 4 simple but effective Ayurvedic home remedies to improve sperm health. These videos have invaluable information which will empower you to help you get closer to your dream baby. If you have missed any of these videos, make sure you watch them soon. You can DM us for the links. And today, I will be answering a few questions I have received on DM in the last month. Let me choose. Okay, the first question is he writes, I am 39-year-old and my wife is 34, and we are trying to conceive for more than 2 years. All my wife's tests are done and my semen analysis is also done. My doubt is if I also need any blood tests. First, he has not shared the results of his semen analysis anyway. Like I have explained in one of my previous videos in detail, doing a blood test and semen analysis gives us the complete picture, full picture. By comparing various hormone values in your blood test with your semen parameters, we can get some insights about how to correct the problem in the semen. For example, we may notice the estrogen levels are higher than desired, or the testosterone values may be low, which could be affecting the sperm count. Or if your cholesterol levels are high, or there may be a thyroid dysfunction, which may again have negative impact on the semen parameters. Unless these parameters which you see in the blood test are corrected, it is difficult to see positive changes in your semen. That's why doing both of them helps. Do a blood test for testosterone levels, fasting insulin and HbA1c, complete thyroid profile, estradiol, FSH, LH, vitamin B12, and vitamin D. Make sure all these tests are done on empty stomach with a fasting period of at least 10 to 12 hours. I've made a detailed video about this. You can check on my Fertility Ayurveda Instagram page. I hope this helps. Let me choose another question. Hello, ma'am. I am 29 years old and my husband is 30, and we are planning to start a family. I have irregular period from a long time, and that is why I am doing test and scan. But my husband does not have any problem during intercourse, and he eats healthy and is not a smoker or a drinker. Should he do the semen analysis also, or should he wait? My recommendation is that the semen analysis should be done at the beginning itself, because there are no symptoms of low sperm count or low motility or low morphology. I have repeated this many times. Remember, these abnormal semen problems cannot be predicted without doing a semen analysis. Also, it is very important to understand that sexual function, that is having intercourse, need not have anything to do with the semen parameters. They're completely different pathways and functions. Let's say a male partner with a low sperm count or a low motility or a low morphology need not have erectile dysfunction or any other problem with intercourse or premature ejaculation or any kind of sexual dysfunction. The male partner may be able to have proper and frequent intercourse as well, but may still show problems in the semen analysis. So it only makes sense to do a semen analysis to understand the status of your sperm health for faster conception. I hope this helps. The third question I'm choosing is okay. This couple writes, we are a 31 and 33-year-old couple who want to start their fertility journey. Please suggest how to start preparing and how early should we start preparing. I really love this question. It's really good to know that couples like you guys are understand the importance of preparation before trying to conceive, because it's not just about having a baby, but it's about having a healthy baby. The health of the couple at the time of conception determines many factors for healthy pregnancy and healthy baby. I would highly recommend you to start working on your diet and lifestyle, include exercise, good sleep routine, and start looking after your gut health. And also just get a general health assessment. Start all these changes at least 3 months before you start trying. Okay. Apart from this, also many couples ask me when they should start doing the fertility assessments, not the general one, the fertility checkup. Let's say if you're a couple where the female partner is below 35 and both the male and female partner don't have any pre-existing condition, comorbidities like thyroid dysfunction or PCOS, irregular periods or diabetes, you can try for 1 year regularly. And if you still don't succeed, then proceed for the fertility assessment. And in case you are a couple over 35, do not wait for more than 6 months of trying regularly. And if you do not conceive, then start your fertility assessments after 6 months of trying. I am choosing another question. This couple say, we are a couple undergoing fertility treatment. My age is 34 and my wife is 30. My estrogen levels are above 40 and I have been told by doctor to take treatment, but it's still not reducing. Can you advise remedies? Unfortunately, they have not given any other details about their fertility treatment or what treatment they did to reduce the estrogen. Okay, it's difficult to advise with very few details. At least sharing your height and weight or your BMI would have helped me to give you specific advice. Like if you're overweight or if your BMI is above 27, let's say, reducing 5 to 10% of your weight will have a good impact on your estrogen levels to reduce estrogen levels. The second thing is work on your gut health and liver health and to make sure adequate estrogen excretion. So it stops accumulation of the estrogen. Hope this helps. Okay, another couple writes, I am a 37-year-old male. I have done my semen analysis and it shows less than 1 million sperms and zero morphology and zero motility. We are very shocked with the result. I don't have any other health problems. Please advise further course of action. First and foremost, don't panic. Repeat your semen analysis. Whenever you see extremely poor results in your semen report, please repeat it after 3 to 4 weeks without fail. When you repeat, please look for a good andrology lab with computer assisted semen analysis facility. I mentioned about CASA in my previous video as well for accurate results. Avoid the labs which use manual analysis to reduce human error. Also remember, if you have had any recent illnesses like viral fever or any other infections, it can have negative impact on your semen analysis report. So do the semen analysis only after 4 weeks of complete recovery. So do not panic. Repeat your semen analysis in a good andrology lab. Okay, I have time for another last question. Okay, they write that in my semen analysis report, it shows liquefaction time is more than 1 hour and high viscosity is there. Please share treatment. Again, I would need much more details to be able to guide you, but let me give you two general remedies. One is you should increase your water intake just to get an idea about how to calculate your how much water you need. Calculate your body weight in kgs and multiply that with 40 ml. That is 40 ml per kg body weight, and make sure you consume that quantity of water per day. You can even drink warm water in winters. Another advice is, again, if your BMI is above 27, focus on reducing your weight through healthy diet and exercise. It will surely have positive impact on your liquefaction duration unless there is some other hormone imbalance. Remember, the normal liquefaction duration is between 15 to 30 minutes. I hope this helps. All of you feel free to send your questions on DM, but share as many details as possible to get specific advice. Don't just dream of a baby, plan for a healthy baby with Ayurveda. Good night, everyone.